All right, go ahead.
All right, awesome. So our project is on the Department of Health and Human Services, otherwise known as HHS. So we can go on to the next slide. Yeah. So the first thing we wanted to talk about is the overall organizational structure of the Department of Health and Human Services. So as you can see in this slide, this is the whole organizational structure, with the head being the secretary. And we'll later on in the slides discuss more of the top part of the chart as far as the secretary, the chief of staff, and those things. And we'll also discuss a little bit of the pretty big, I guess, groups underneath. So like the FDA and the CMS and things like that. So, sorry, the CDC. So if we can go to the next slide. And so the HHS agency and offices, there's 11 operating divisions. 8 of those are under the U.S. Public Health, and the other 3 are under the Human Service agencies. And so the Office of the Secretary, the OH, that administers and oversees the organization, its programs, and the activities. And the Deputy Secretary and a number of other Assistant Secretaries kind of support that Office of Secretary. And so the IEA, or the Office of Intergovernmental and External Affairs, they serve as like a liaison. So like what, from my understanding, it's like a communicator, I guess. So a communicator to the state, local, tribal, and the non-governmental organizations. And it disseminates the information regarding the HHS policies and regulations. So like I said, they kind of facilitate communication between the department and stakeholders regarding different initiatives and policies. They also have another role of representing the intergovernmental and external, I guess they serve as like, they help with like policy making, if I understood correctly, and with those policies, they try to clarify it to other officials and stakeholders. And so here's the director of the IEA. Her name is Nikki Bratcher Bowman, and she's the current director of the IEA. And so, like I said, about the duties of the IEA, she kind of oversees that. So she manages the budget, the financial resources, human resources, that whole list on the PowerPoint slide. And yeah, so that's pretty much what she does. So I think that one is Georgina.
Yes. The Executive Secretariat manages the department's development and review of regulations, correspondence, reports to Congress, and other policy documents, facilitating discussions to reconcile policy disagreements. They are experts on HHS-administered programs who identify, manage, and help resolve the many complex and technical issues the department must consider. When an issue requires a secretarial decision, they ensure that the secretary receives thoroughly developed options and supporting materials on an issue. And the next slide, please. Thank you. The Office of the Secretary. So our current HHS Secretary is Thomas E. Price. Dr. Thomas E. Price was sworn in as the 23rd Secretary of the Health and Human Services on February 10th, 2017. Most recently, Dr. Price served as a U.S. Representative for Georgia's 6th Congressional District. He held this office from 2005 to 2017 and earned a reputation amongst his colleagues for being a tireless problem solver and the go-to expert on healthcare matters. During his congressional career, Dr. Price served in various leadership roles, including Chairman of the House Budget Committee, Chairman of the House Republican Policy Committee, and Chairman of the Republican Study Committee. The Office of the Secretary has 14 individual offices that are individually split up in their own organizational charts. And that's the end of that one. So I just kind of, I'm kind of introducing the people who currently hold offices in these specific um, positions. And so with our very first slide, you saw a long chart. And I just chose a couple of these people to present. Um, so Office of the Assistant Secretary for Administration. Our current Secretary for Administration is Christine Major. The Assistant Secretary for Administration provides leadership for HHS departmental administration, including human resource policy, information technology, and departmental operations. The ASA mission statement: to oversee all HHS department branches in the areas of human resources policy, equal employment opportunity, diversity, facilities management, information technology, and the department's service operations. And that's the end of that one. And Office of the Assistant Secretary for Health. So this is another one of the categories that was in the chart. The Office of the Assistant Secretary for Health leaders are dedicated to developing policy recommendations as they pertain to public health issues that cut across HHS agency and operating divisions. So in this paragraph, it's just a bit about Don Wright. He was named Acting Assistant Secretary for Health at the U.S. Department of Health and Human Services on February 10th, 2017. He leads development of HHS-wide public health policy recommendations, oversees 12 core public health offices, including the Office of the Surgeon General. Dr. Wright is also the Deputy Assistant Secretary for Health and Director of the Office of Disease Prevention and Health Promotion, a position he has held since January 2nd, 2012. And I believe this is someone else's slide.
Yeah, sorry, this one's mine again. So like I said, and kind of like Georgina said too, we kind of chose, I guess, different organizations that are underneath. But one that stuck out to me was the FDA, just because that's one that a lot of people know about. And so the FDA, as you can see, it oversees regulations of medical supplies, of tobacco, and of food. And it's split into, I guess, 4 or 5 different offices. So there's the Office of the Commissioner, the Office of Foods and Veterinary Medicine, the Office of Global Regulatory Operations and Policy, and the Office of Medical Products and Tobacco. And so the guy that you see there, he's the commissioner. It's Dr. Stephen M. And so he oversees the food and animal health activities of the FDA, including the FDA's responsibility in the areas of food safety and nutrition, food labeling, food color, additives, cosmetics, dietary supplements, animal drugs, and animal feed, and research to support the food and veterinary medicine mission of the FDA. And so, yeah, that was just one of the major organizations underneath the HHS.
All right, and so I looked up the principal players of the organization. So if you look back at the organization chart, it would have kind of split into two different sides. And one side was the Office of the Secretary. And so this little page has all the names of them. So like they were saying, the Office of the Secretary was Tom Price, and then I'll just read through them real quick. So the ASA, Office of the Assistant Secretary of Administration, was Christine Major. The Assistant Secretary for Health is Don Wright. The Assistant Secretary for Legislation is Barbara Clark. The Assistant Secretary for Planning and Evaluation is Lena Bush. Assistant Secretary for Preparedness and Response is George W. Korch. And Assistant Secretary for Financial Resources is Norris Cochran. I'll just go by the abbreviations now. So the ASPA is Bill Hall. OCR is Robin Hose. The DAB is Constance B. Tobias. The OGC is Jeffrey S. Davis. The OGA is Mitchell I. Wolf. OIG is Steve A. Lennick. OMHA is Nancy Griswold. The ONC is John White. He's an MD. And then at the end of the site, we also have a link that has all links to all these people. And then on the operation division side, we have these people. So we have ACF is Amanda Barlow. The ACL is Dan Berg. The AHRQ is Sharon Arnold. The CDC was Rear Admiral Anne Shushat. The CMS is Patrick Conway. The FDA, as Michael was saying, was Stephen Ostroff. The HRSA is Jim McCrae. The IHS is Rear Admiral Chris Buchanan. The NIH is Francis S. Collins, MD. And then my little phone is blocking it. And then the SAMHSA is Kanai Inamoto.
Okay, so what is the U.S. Department of Health and Human Services at HHS, and what does it do? So this is basically what it is, and kind of like their mission statement, like of what they are, kind of like in a nutshell. So U.S. Department of Health and Human Services is U.S. government's principal agency for protecting the health of all Americans and providing essential human services, especially for those who are least able to help themselves. Their model is simple: health, safety, and well-being of America. The HSS provides healthcare coverage to more than 100 million people through Medicare, Medicaid, and the Children's Health Insurance Program, and the health insurance marketplace. Their function is to promote patient safety and healthcare quality in a healthcare setting and by healthcare providers, by ensuring the safety, effectiveness, quality, and security of foods, drugs, vaccines, and medical devices. The HHS also prevents and manages the impacts of diseases and chronic diseases and conditions, including the top causes of diseases, disability, and death. So the department manages 115 programs across its 11 operating divisions that cover a vast range of activities that impact health, public health, and human service outcomes throughout. So right here I labeled about, not all the programs, but the more common ones that we see on a daily basis, like health and social science research, the preventing disease, including immunization services. That includes the CDC, the Center for Disease Control. They also ensuring the food and drug safety, that's with the FDA, and the assurances that are the Medicare, which is health insurance for elderly and disabled Americans, and Medicaid, which is health insurance for low-income people. Really big with health information technology, and they're always providing like better ways to improve that. And they're the ones that started the have your medical records in a computer and being able to access it digitally versus paper like it used to be. And they also provide financial assistance and services for low-income families. So that's more of your, like, in your area, your community service agencies. And they also help in improving maternal and infant health, including a nurse home visitation to support first-time mothers. So are part of Head Start, which is a preschool education and services. And they also are doing the preventing child abuse and domestic violence, substance abuse treatment and prevention, services for Americans, including home delivered meals, health services for Native Americans, and medical preparedness for emergencies, including potential terrorism.
Okay. These slides are kind of an overview and kind of a recap, so I'm not going to read them all to you. Like they said, there's 11 operating divisions. So these 3 are the human service agencies, Administration for Children and Families and Community Living, and the CMS, which will be presented in the other presentation this week. The other 8 are the Public Health Services, Substance Abuse and Mental Health Services, Agency for Toxic Substances and Disease Registry, the Health Resources and Services Administration, Agency for Healthcare Research and Quality, the Indian Health Service, the National Institutes for Health, and the Food and Drug Administration. Now, I had actually only heard of a few of these, so it was kind of surprising. how many were actually under the Health and Human Services. And then the last one is the CDC, which I decided to highlight, which you see in all the movies, the people in the big white mask going into scary looking diseases and trying to figure things out. So I really admire them because I would never do that. But their mission is to protect America from health, safety, and security threats, both foreign and in the US. Whether diseases start at home or abroad, are chronic or acute, curable or preventable, human error or deliberate attack, the CDC fights disease and supports communities and citizens to do the same. So that's actually their mission statement. They increase health security for our nation. The CDC saves lives and protects people from health threats. And then to accomplish that mission, they conduct critical science and provides health information to protect our nation against expensive and dangerous health threats and responds to those threats when they arise. So this is how they operate in the 21st century. They're on the cutting edge of health security. They are confronting global disease threats through advanced computing and lab analysis of huge amounts of data to quickly find solutions. They put that science into action. They find out what is making people sick, and they find out the most effective ways to prevent it. They help in medical care by bringing knowledge to individual health care and community health to save more lives and reduce waste. They're fighting diseases before they reach our borders, so they are going outside of our country to find out how to stop those from coming into America. And they are nurturing our public health. They're building on our significant contribution to have a strong, well-resourced public health leaders and capabilities at national, state, and local levels to protect America from health threats. And then these are our sources.
Awesome. Great work, you guys. You covered the topic really well. The Department of Health and Human Services is massive, as you're, I'm sure, very aware now after studying it, and it plays a very important role in the healthcare in our country. And I'm sure a lot of you have also noticed that a lot of a lot of those positions have changed recently with our new president and Dr. Price. Brand new in his position right now. So a lot of big changes going on. So what I typically do now at the end of this is I'll ask each of you what the most interesting thing is that you learned as you were studying this topic. So I mean, I will ask each of you that question, and then just briefly give me a quick answer about what the most interesting thing was that you discovered while you were studying this topic. So we'll start with you, Andrea, and then I'll just continue to ask the rest of you after she answers.
I think the most interesting thing is how huge it was, how many operating divisions there were. Like, I've heard of the FDA and the CDC and CMS, but that's it. And so I was surprised to learn that there were so many other operating services.
Awesome. Georgina.
As I was studying this topic, I was very impressed with the people who hold these offices. Many of them are physicians, and as I see, physicians are extremely busy, and yet most of them hold public office. Well, this is a public office, and they're very into their policies, and I just think that's really fascinating. That's an example to me, despite how busy I may be, to always take a step back and to look at what's going on in the healthcare field and in government policies.
Awesome. Jesse, same question.
For me, it was kind of along the same lines as them. I wasn't aware of how many operating divisions there were that specialized in certain things, such as like the substance abuse and mental health services, or the ACF for children and families. And then also like looking at some of the people who are involved. A lot of them were actually a lot younger than I thought they would be to be involved in government services, so I was kind of surprised by that.
Awesome. All right, Michael.
I mean, I of course was super surprised, of course, by how big the organization was. But I guess to say something different, I remember too, just for fun, looking at the budget, and it's crazy to see how much money they put into this. Like, I read that the budget proposed, it was over $80 billion in funding and stuff like that towards all their different projects. And so I thought it was pretty cool just to see how much money and how much time goes into this whole entire organization.
Awesome. All right, and Yasmin.
Well, when I was doing my slides, I thought it was really interesting that they're like the four most frontward, I guess, of the health information technology. Where like back in the day, it was just like go to your doctor and see them, but they've advanced it so far now where you don't have to like physically actually see your doctor. You can do like video chat, over the phone, text, email. And I thought that was like really important because back then you were kind of like forced to go to the doctor's office and you felt like you're sick and she's like, oh, get even more sick. Because I mean, I know I have Kaiser and I can video chat with my doctor, or I can just email them and, you know, get help instead of actually having to go, you know, pay your copay and whatnot and visit them. And then another thing I thought was very interesting was that the Head Start program was part of this. And she just retired from being a teacher at Head Start. And I never knew that like that program was like associated with this, because you think like, oh, it's just teacher school education. But like, I was asking her about it and she said, you know, it's not just like teacher school, the kids get education. They also like offer like, I guess like resources for like low income families. They do like referrals for food or shelter, or like just like they all branch off. So it's not just like one program doing just one simple thing. That one program may be branching off to others. And I thought that was very interesting.
Great. Awesome. Well, again, great work, you guys. I'm going to go ahead and stop recording, but stay on the line for just a sec.